One of the common questions that we get asked as doctors for people who have diabetes is it okay for me to have surgery even if I have diabetes? Sometimes you may need surgery for a diabetes related complication. Sometimes you may need surgery for something that's not related to your diabetes and could be either urgent or an elective procedure. And it's a good concern to have if you do have diabetes and consider that you might be at higher risk for some problems that would be associated before, during, or after the actual procedure. The most common reasons that you're going to have potential problems with diabetes related to having surgery would be the actual stress of the surgery can be a potential disruption to your blood sugar control during the perioperative period. You can also have a slower healing time, you can have a higher chance of infection, and you can have an increased risk of cardiac problems during the surgery itself. With proper management, these risks can be minimized through a comprehensive plan with the surgeon and the primary care provider. So somebody who has diabetes really should not be scared at all to have surgery under the right circumstances if they have good perioperative control of their diabetes. The key to minimizing the risks to complications from surgery if you have diabetes are to, first of all, keep your blood sugar under control during the entire perioperative period. You're going to want to see your primary care doctor prior to surgery for instructions that they're going to give to you so that you can manage that in conjunction with your surgeon. You want to have a very close team and they want them all to be able to know the things that are going on during the surgery so that you can coordinate with both doctors. You're also going to want to follow your doctor's instructions regarding which of your diabetic medications to take and when to eat. This is really important part of being able to keep your blood sugar under control. And lastly, you want to report any problems that you have immediately after surgery to your doctor. This is going to really be key to minimizing any type of complication that you would have during the perioperative period because of diabetes. Modern medicine has come a long way in the last recent years, and somebody who has diabetes really shouldn't be that scared about having surgery if they've properly taken the steps necessary prior to surgery to coordinate with their primary care doctor, to coordinate with their surgeon, to make sure that they answer all their questions and to follow the instructions that are given to them by their doctors. In summary, the best thing that you can do is to follow the instructions of your doctors. They're well trained, they know how to treat people who have diabetes, they've done many surgeries on people who have had diabetes before. If you're going to have one key thing that you need to do is just make sure that you keep your blood sugar under control during the entire perioperative period. And this is just not something that you do during the perioperative period, but it should be something that you'd be doing throughout your entire life to be able to really decrease your risk of complications for any possible thing that could come up due to your diabetes. So make sure you ask the right questions to your doctors, make sure you keep your blood sugar under control, and go ahead and have that surgery if you need to have it. If it's recommended by your doctor, if you've talked to your primary care doctor, you should be just fine with having your procedure.